So this is Portia, and I'm here to do presentation for the medication that we have to do presentation. And the medication I've chosen to work with is Dantrolene. Dantrolene is a muscle relaxant that is usually prescribed to resolve conditions for people experiencing severe muscle spasticity or muscle contractions in conditions like cerebral palsy, multiple sclerosis, and even people with spinal cord injuries. But particularly, dantrolene is used to resolve like acute conditions like malignant hyperthermia. It can be offered by mouth or IV depending on how severe the condition is. And dantrolene works by reducing motor contractions through direct action with skeletal muscle fibers. It inhibits the release of calcium ions, which helps relax muscles, and it prevents intense contractions seen in conditions like malignant hyperthermia. Yes, and the amount and the dose prescribed depends on how severe the condition is. Most of the times, I always start from like a low dose and then go up and up and up as needed. Common side effects of dantrolene include dizziness or drowsiness. That's why patients are encouraged not to drive or use machinery when they're on the medication. Also, since it helps to relax muscles, it can cause muscle weakness. So patients are also encouraged not to engage in activities that need like good muscle strength. Yes, and another side effect that patients who are on dantrolene might get is diarrhea. And it's recommended that patients on dantrolene, especially if they're experiencing diarrhea, they should stay hydrated by drinking more fluids and eating fruits that have a lot of water. Yes, and if the diarrhea is like becoming so severe that even as they're trying to stay hydrated, it's not helping, they need to reach out to the healthcare provider. And because it causes muscle weakness, it causes diarrhea, of course, it will also cause fatigue. Imagine being super weak and going to the bathroom so many times, of course, you will get very weak because you lose all the strength just by releasing those, like the diarrhea. Yes, it makes you weak, and then they also get dehydrated. So they are encouraged to try to stay hydrated and try to eat foods that probably foods that are high in carbohydrates because that has like glucose that will give them strength. And patients on dantrolene, they are also at high risk for liver toxicity because dantrolene is detoxified in the liver. So patients on dantrolene, they need to get a regular check on their liver enzymes. So they are encouraged to make sure they don't miss their checkup visits, their frequent doctor appointment, and we also need to educate the patients on early signs of liver toxicity, which could be like yellowing of the skin, yellowing of the eyes, dark urine, or even abdominal pain. We know our liver is right here on the right upper quadrant, right below the ribs. So if they start to have tenderness and soreness around there, we encourage them to make sure that they reach out to the healthcare provider to go. Maybe they might run an early liver test assessment to see if they're having like liver problems, which could be a sign of toxicity. And a serious side effect of dantrolene is respiratory depression. Because the muscles are being relaxed, it relaxes even the muscles of the respiratory system. So sometimes they might have difficulty breathing, and they should report any difficulty breathing to the healthcare provider as soon as possible. And dantrolene can also cause allergic reactions like severe rash, itch, dizziness, or swelling, and this should be reported to the healthcare provider as soon as possible. The patients need to adhere to the drug medication regimen as ordered by the doctor, avoid drinking alcohol, they should also avoid driving, avoid operating machinery, and they should make sure that they report any sign of liver toxicity to their doctor. Thank you.